Welcome back to Core Anesthesia. Whether you are a student prepping for tests and boards or a CRNA here to earn CEUs, we are glad you've joined us. For more about us, make sure to check us out on Instagram at Core Anesthesia and online at coreanesthesia.com.
Welcome back to Core Anesthesia. I'm Cole, here with Tanner, and today we want to continue our summer series going through just some of the emotional side of things with anesthesia. We first talked about mistakes that can be made, whether you're going through school or whether you're practicing as a CRNA, and how you respond to those mistakes when they arise, because it's not an if it's going to happen. We're all humans. It's when something does happen, and how do you minimize the severity of that mistake, and how do you handle that from an emotional standpoint. Moving on from that conversation, we're now going to talk about imposter syndrome, and this is something that I've been hearing more and more about from people. Just the idea of us working in these roles in which we're expected to, have certain responsibilities, have certain knowledge of things, to be able to handle certain scenarios when they arise. And how does that affect from a just emotional standpoint, this idea of imposter syndrome, where you start to wonder, am I appropriately in this position? Do I know enough to be in this position? Can I handle these scenarios when they arise? So this is something that we hear more and more about. It's an emotional struggle that a lot of us may deal with on different levels and different severities, but I think it's worth talking about.
Yeah, I totally agree. And I know it's the most boring way to start any kind of speech when the Webster's definition of et cetera is, this, that, and the other. But I do think it's important to have some sort of idea or definition of imposter syndrome. This is something that's kind of a buzzword. People talk about it all the time. And I don't really think I had a clear understanding of it until we started the podcast. I think is when the first time that I really started having some of these feelings and some of these ideas were coming into my head. And so the idea of imposter syndrome, just to get it started here, is it's an idea where you consistently are doubting your accomplishments, even though you have evidence that shows that you are successful or you are meant to be in that space, but you have these persistent thoughts of doubt, or you have a fear that you'll be exposed as a fraud. And so I think this idea is, you're in a space, but you have this pattern of thinking that, well, what if I'm really not supposed to be here? What if something happens and I'm not an expert, or I'm exposed? And so that's really what we're talking about when we're talking about imposter syndrome. And this is something that I hear all the time with residents that they have struggle with, and they are nervous about, especially as they transition into practice. And it's very real. I think we all go through it at some level. And I'll start off by saying I think it's one of the things that we do not do a great job as preceptors in encouraging for our residents is, you're in a training situation where we're constantly critiquing, or not even critiquing, but giving tips or saying, do this, that, or the other differently. Yesterday, I had a resident with me. He was awesome. He was a senior, ready to graduate. He's doing a great job. And I found myself still throughout the day, I'm still just making little pointers of like, hey, do this or try this, or have you done this before? Let's try waking up this way instead. And I was like, man, I remember being in that situation where even though you knew what you were doing, you're still just, there's comments all day long about, little things to do differently or try differently. And where I think we miss, where I don't think that we do a great job as preceptors, is we are constantly, I think, the ones in the room that, if something happens, we're the one that speaks up, or if something needs to change with the procedure or we need to communicate with the surgeon, we're the ones that speak up a lot of times. And then we expect you to graduate. And then day one, now you're supposed to be the voice in the room, and you're supposed to be the one that is communicating to the whole room, setting the tone for the whole room. And we've really not practiced that, I don't think, effectively while you're in school. At least that's been my experience. Hopefully that's different for you wherever you are at. But I think it's a miss. I think it's something that we don't encourage as much as we should. And I think it leads into this imposter syndrome where day one, now you're in the OR, you know that you're new. Everybody else knows that you're new. And it goes back to this doubt of yourself, that you think that you could be exposed, or that you think that you don't belong. And we haven't done, I don't think, a good job as a group encouraging people to step out and be that voice and be the control in the room, even while they're residents. And it's a hard thing to switch over. And then with that comes a lot of second guessing or doubt, or am I really meant to be here? Am I really supposed to be in this position?
Right, and I feel like for me, it didn't hit the quote imposter syndrome didn't hit until I graduated. I guess I always backed up on this idea of, well, I'm still a student, I'm still a learner, so it's okay that I have these feelings of doubt that I'm not adequate enough to be a CRNA or to be handling this solo. Not saying that you can't have that through school, but for me, it hit when I transitioned into the OR as a practicing CRNA, and I remember my first quote incident in the OR where I needed to do an intervention that I was the only one in the room capable of doing. And I realized how much I relied on an extra pair of hands helping me when I was in school, even though you get to, senior year and you're kind of wanting your preceptor to just sit back in a corner or to leave the room for a little bit. You just want to act solo. You want to be your own provider, but you always knew in the back of your mind that they were there to back you up, or to at least if you were going to be doing something detrimental to the patient, that they would stop you. At least I always had that mindset of, if I want to make my own decisions, but if I'm doing something wrong, they're going to stop me at some point.
Right. Yeah.
And then I remember when I was on my own those first few weeks, it was a big transition, and I went into a level 1 trauma center where we have a ton of ASA force, and I was getting some sick cases right off the bat, and I just remember that those first couple moments of everybody's looking at me, and I say, "Well, how do you guys usually do this?" And they say, "How do you do it? You're the one that's doing it." And that's when it really hits in. Like, they're looking at me to be able to handle these situations. Am I adequately prepared? Am I competent enough to be in this position, to be the one making these decisions?
Mm-hmm.
And for the first few weeks, it was like, well, I want to defer to what do the other CRNAs usually do here? Like, but no, that switches to, what do I want to do? What do I know based on my training, my expertise? What should be the intervention of choice here? And I'm not relying on somebody else to make that decision. So it really hit me those first couple weeks of, am I in the right role? Like, am I prepared enough to be in this role? Am I prepared enough to be making these decisions? And mentally, that was a struggle for me.
100%. And I want to back like way up to one of the things you said at the very beginning. You said when you're in school, you could kind of fall back on like, oh, I'm just the resident in the room, so it's like, it's you got someone to fall back on. And I think that is really where it starts, because you're thinking of yourself, like you're doubting. I think in that statement, like you're doubting your usefulness or your role in that room. And I think that's like, we start there, because as a resident, like especially as you're getting towards the end, you're the one that's controlling the room. You're the one that is dictating what's going to happen, how you're going to care for the patient. Obviously that's always filtered through whoever you're with and whatever training setting you're in. But I think that's where we start with it. We start there when we're thinking like, I know my place. I'm just X, Y, or Z. And really, like, you're the one you are a nurse that has been in the ICU, that's been training for years for anesthesia. Like, this is not a small thing that you're in the room and that you are taking care of this patient. And I think that we kind of get in that mindset of like deferral. And then I think that is where it starts. And then when you have the switch to CRNA, like you just said, you're asking, well, what does, someone else do? Or what do you guys typically do? And it's weird to go from, oh, I'm just like, we shouldn't be going from, oh, I'm just the resident in the room, to now having those conversations of like, oh, this is what I want to do. Like, it's a huge leap to make just overnight. And so I think that's, again, going back a little bit to, I think we need to adjust our training, but I think that the mindset needs to start while you're in school. Cause I agree. I did the same thing. I remember it was like the first week I was like, oh, you guys normally do blocks for these cases? And the CRNA was like, do you want to do a block? Do you want to do a block for the case? And I was like, oh, I didn't see it on the schedule. And he's like, yeah, do you want it? Like, is that part of your anesthesia plan? Do you want to do a block? And I was like, yeah, I'd love to do a block for this. He's like, okay, do a block. I was like, oh, okay. Like, I was so used to like deferring to somebody else and just kind of trying to fit into whatever clinical site I was at and doing whatever anybody else was doing. But it's a gut check moment. And I think there's like, I don't know, do you think there's a healthy side of imposter syndrome where we're not advocating for arrogance or just like my way or the highway? I know everything and I belong to be here and we're going to do it my way. There's a healthy side of it where you're real with yourself and real with your capabilities and your scope and your understanding of whatever disease process or problem or case that's going on. So I think there's maybe a healthy side of it too, where we're not advocating that you just show up to, clinical and you're like, hey, I belong to be here. Buckle up. It's going to be a great ride today. You're with me. I feel like your receptor's going to be like, oh, okay. Uh, yeah. But I think that there's like, there's a balance there where like you're meant to be there. You've earned the right to be there. And, it's that negative self-talk when you're doing things that you should be doing and that you should have control and you belong in that space. And yet you still have this voice in your head that's like, oh, I hope that I'm not exposed here. I hope that they don't realize that I really don't belong here.
Well, I think a lot of it becomes the idea, and I say this all the way through. Like any learner I have with me, I say you need confidence, but not cockiness.
Mhm.
There's a definite difference there. You need the confidence to be, confident in your decision making. You need to be decisive on things because you've learned didactically as you've gone through the program, and especially as you graduate and become a CRNA, you've passed all the required material you need to become a CRNA. You didn't just get there because you forged some signature and you made up some resume and you got a job and you're sitting in the OR. Like
Right.
you earned a degree. I mean, I hope no one's out there doing that, but
Right.
uh, it's another catch me if you can
That's
scenario.
like, yeah, I was gonna say, or like Dr. Death. He didn't forge his way through, but there's probably someone out there. You can contact us, info@coreanesthesia.com if that's you. We will report you, just so you know.
99.9% of us have
Yeah.
earned our way to get to this point, correct? And so we are have confidence in that fact that you have learned enough and proven along the way that you know enough to be in this position that you're in. Have confidence in that fact. Like if your gut is telling you something, trust your gut because you have gotten there for a reason. But you don't become cocky. That is the most, I think, one of the most detrimental things that can happen to
Mhm.
aesthetists is to become overconfident and over cocky in their abilities. You have to know what you don't know, right? When something comes up, just know that it's an ever learning process. You don't graduate anesthesia school and never touch a single learning material again the rest of your career.
Yeah.
If you don't, you're going to fall way behind. You can tell the CRNAs that are towards the end of their career that have said, you know what, I don't care to learn ultrasound, or I don't care to do this. Like, you can tell when people start to phase out and stop learning
Mhm.
newer things. And I'm not saying you can't practice as a CRNA, but you're not gonna be able to provide the best care to a patient. And so when you go in with the mindset of, "There are gonna be things that I don't know," you know your limitations, and I think that's where it becomes I don't know, distinguished from cockiness or overconfidence. I had a patient in the OB world the other day had a unique disease process, and we had some issues back in the C-section. Um, and it was something I'd never seen before. And so I was more concerned. I was a lot more. I don't know. The circulators in the room could tell I wasn't as relaxed as I normally am. Let's
Mhm.
put it that way. And I was doing some things or asking for some things just as precautionary reasons, without going into detail of this patient's issues. But later, they were doing change of shift report, and they didn't know I walked in the back of the room, was listening to change of shift. Because we do 24-hour shifts, but they do 12, and so they were switching out. And I always like to pop in and get an update on the report. And they were mentioning something about this patient who is now in recovery, and they said something like, "Yeah, if Cole was nervous and standing there, that like something bad is happening. If
Mm.
Cole was standing up, being nervous." And somebody, without knowing I was there, was like, "Oh yeah, I'd follow Cole off of a cliff, like straight off of a ledge."
Oh, that's cool, dude.
And I'm hearing that, and I'm thinking, do they know how much I just looked up about this patient and
Right.
like I had to literally research about this disease process before we went back there, and I was
Yeah.
nervous the entire time because I've never seen it before.
Yeah.
And so that I started to have that imposter syndrome at that point of,
Mhm.
these people trust me, and they're like, if he were to say to do this, we would do it, even if it's jumping off a cliff. Like I doubt they actually would do that, but it was really nice to hear that. But
For sure.
but rather than take that as a big confidence booster, I actually had this moment of, like, self-doubt when I heard that, because I'm like, do they even know how much that I didn't know about this patient scenario?"
Right.
moments before that case happened. And
Mm.
I had to research and hope that I was prepared enough for it. Uh, so yeah, I guess I'm getting long-winded,
Yeah.
but there's a
No,
difference.
that's powerful. Yeah, I think that's exactly it. And it's like you you know your own mind space. Like you know all the thoughts that are running around in your head. And I think that's where this imposter syndrome starts getting kind of unleashed, is because you know all the doubts, you know all the questions, you know that internally, whether you're being realistic about those or not, like you know that those are going around in your head. Nobody else knows that. And so I think that's where you're like, that fear of exposure is you're nervous that, you know, a question is going to be asked or something's going to happen and you're not going to be prepared, and you just, in your mind, you feel like, yeah, you don't belong. And I think that um yeah, I think that's a really powerful story, because you see both sides of it. You see the side of the people that are onlooking, and you see what's going on in your own brain and your own head as you're going through that experience. And I wonder too, like if imposter syndrome is tied closer to, like when you have a change of identity. I would think that it kind of makes sense in my brain that it goes together. But like while you're going through school, you are changing as an ICU nurse from day one to then becoming an anesthesia provider at the end. Like you are a changed person. You're a totally different person. And maybe you've come to terms with who you are as an ICU nurse. You feel very comfortable in that setting. You have you worked there for years and you've cemented that identity in your brain. And now you've changed to a completely different person. I mean, you really do when you go through school. When you graduate, you look back for the 3 years and you've completely changed. And now with that new identity, I feel like that's where the imposter syndrome sneaks in, because you've not fully cemented, I don't think, your identity in your brain of that you are that person and that you are capable and that you are yeah, that transition, I think, is where some of that imposter syndrome will sneak in, because you haven't had the time to really sink into that and have confidence in knowing that you do belong. And I think that it gets better with time. um I think imposter syndrome is something that typically is happening during that transition period, and as you do it longer, like going back to the podcast, like I would never, how long do we start this? 5 years ago? Like I never would have, if you would have told me that day, like, oh, you're going to be a podcaster, I'd be like, oh, okay. All right. That, like, those are people that live in California and are way cool. And then you do it and it's like, anybody can podcast. You just pick up a mic and talk with your friends or do whatever. And I feel like when you're doing it, you feel this kind of weird, uh, disjointed, like what are we doing phase. And now that we've been doing it for 5 years, I have people that ask me for advice about, like, they want to start doing a podcast on this or that or the other, and you feel much more comfortable speaking in that situation just because you've had more time in it. And I think the same is true as you're going through anesthesia training. Like that imposter syndrome, I don't know. I wouldn't say that it goes away completely. Like there's still, like you said, that happened to you last week with that situation. So I think there's things that will bring it back up. But I think overall, there's aspects of it that definitely get better just with the time.
Yeah, yeah. To echo that, I totally agree. So someone told me when I first started out of school, they said your first year, you're going to grow more than you probably did in any of the years in school. And at the beginning, I thought, well, I mean, I learned a lot and changed a lot during school. So I don't know how this first year is going to be more so than that. But in a lot of ways, they were right. I grew leaps and bounds the first year of practicing. Not saying that I wasn't adequately prepared to be a safe provider, but there are just a number of unique scenarios that you just don't have all of the experiences in school.
Hmm.
You have the tool belt to use for those scenarios. It's now just applying those in that unique situation that you may not have done when you were in school, or maybe you move across country to a different facility that does things a lot differently than how you trained. And so yeah, I think the first year you have this big growing pain and this feeling of imposter syndrome. Uh, that's healthy. I think that's a healthy fear. Like if you come in day one as a CRNA and are like, yep, boom, I got this. No one can change my mind on any decisions I make. I might be pretty scared to have you as my anesthesia
Oh,
provider.
for sure.
Um, but as you move forward from there, those unique scenarios and those unique things that you haven't seen start to space out in the frequency of which they happen. And so the person that told me this day one said, year one, you're going to have a lot of these. Then it's going to start to shift to, once a month, you have something new. Then it's going to shift to once a quarter, and then it'll be once a year. And then later on in your career, it'll just continue to fizzle, less frequent and less frequent, these amount of unique scenarios you have. But they said you always need to have this level there's a healthy balance, because you have to be confident, but you have to also know that you don't know everything. So you cannot just come in overconfident to every scenario. You have to be prepared for the unexpected to happen and things that you don't necessarily know or assume about a patient or a scenario to happen. And I think there is that healthy balance, and I'm still trying to figure out that exact healthy balance, to be honest, because especially in the OB world, I keep coming back to the OB world, but it's a different form of anesthesia than in the main OR, the days that I'm up there, because you have an awake patient the entire time. You're not just seeing them for a few minutes in pre-op, and the next thing you know, the patient's waking up in recovery, and they probably don't even remember you talking to them in recovery. It's like they only see you for the couple minutes you put them to sleep. And in the OB world, you're face to face with them the entire time, unless you're doing a crash section that you're putting them to sleep for, they're awake. And so there is this level of, you need to appear confident to them, because if you're acting like you're kind of doubting some stuff, it looks very bad to the patient, right? And so there's this level of, you have to be confident in your decision making. You need to appear confident. You need to appear smooth, like you know exactly what you're doing, what the next steps are going to be. But I always tell everybody that comes up, you cannot be overconfident. OB is one of the most humbling places you'll ever be, because there are just things that happen in this unique population in which you can't be prepared for everything. And so I'm still trying to find that perfect happy medium of how to appear very confident, and also how to be confident in my abilities and my knowledge when situations arise, but also know that I don't know everything. And I need to be able to admit when I'm wrong and be able to best provide care for the patient. And I think being overconfident can jeopardize that sometimes.
Yeah, 100%. And I loved what you said. Again, I'm going back to the beginning of when you kind of were talking there. The new experiences space out. I loved how you said that, because that's so true. And that I think is one sense of anxiety relief, when those new experiences are spacing out, but they never stop. And I think that's the humility part of it. Like you just said, that there's constantly going to be things that you go into that you don't know, and you have to constantly be learning. I had one the other day where it's so interesting. And I think the humility in all of it is probably one of the most powerful things to fight the imposter syndrome. And I was talking to this patient. They were coming back for a pretty significant case, and I'm in the room. They have like 10 family members that are in the room, and they're all asking me questions about the specific case. And I remember being, in my own personal life, my brother was in a motorcycle accident when he was in his 20s. And I remember being one of the family members in the room and looking at that doctor that was in the room, just like all my hopes and dreams, all my questions, like everything's resting on that doctor in that moment. Like, I know nothing. I'm looking to you to be the expert, and we're here just to hear whatever they have to say. And in that moment, I'm standing in the room, this last week when this is happening, and there's family members all in the room, and they're asking me questions about the procedure. I'm answering a little bit of what I can, but directing most of those onto the surgeon. And then just talking about the anesthetic and how we're gonna do this, how we're gonna do it safely, and what our plan is. And I'm standing there and I'm thinking, like, these people don't know that I was like 10 hours ago running around my house with underwear on my head with my 2-year-old, dancing to silly songs and being a complete idiot in my own house. You know what I mean? Like, they don't know. Like, in that moment, they see you as the anesthesia provider. You're the expert. And then yourself, like, you are, whatever your personality is, or whatever you're being silly at home or whatever. For me, it's like wrestling around with my 2-year-old and just playing the dumbest games. And there's like this humility, I think, that you have to keep in mind of, like, who you are. But in that moment, they need you to be that person that has the answers, has the confidence to handle the situation. And I think that there's nothing wrong with holding both those things at the same time. Like, that you are a person that is learning, you are a person that is silly dad, or you are just, whatever the case may be. But in that moment, you're being that person for that family member, for that patient, and it's okay to be both. And I don't think that it's not an all or nothing situation. And I don't think that it should discredit any kind of like your training or, your abilities. And I think that our brains are a sneaky place where they can, you know, try to dissuade us from understanding that like you belong there. You're capable and um, perfectly suited to be in that situation. And so, yeah, I think it's kind of a silly game that our brains play with us. I think I remember too, just like real basic things, but I remember when I first graduated, it was like insufflation admin and they started to Brady, and I knew immediately just to say like, hey, can you stop insufflating? I need to get ahead of this a little bit. But like there was a quick thought in my mind, like the surgeon's not going to listen to me. Like I'm a brand new CRNA. I don't have any business like directing or speaking here. And you're like, no, like that's your whole job. And it can be as silly as that, where imposter syndrome will sneak up on you and you're like nervous to say something or to direct something. And even though it's like 100% the right thing, you are completely confident, there's still this unnerving feeling sometimes in your brain that people aren't going to take you seriously, or you're new, or you're just a resident. If that's something that I remember in school a lot. And so it's just there's a lot of factors to it, even if it's 100% the right thing. So it can happen, like I said last week, when I'm standing in front of a whole family member team, or it can happen when you're fresh out of school or in school. There's no end to it. I think it does get better, but it just shows in different forms, I think.
I'm sorry, I just can't get the picture out of my head of you running around your house with the underwear on your head still.
Oh man, it's a dream. We put the underwear on our head. We turn on Macklemore's his current favorite song, and then we just run laps, dude. We're just crushing.
That's awesome. Man, but it's so true though. Like I think that the family members, when you walk into the room, they only see you in that role, but you're coming in and out of different shoes that you're wearing throughout your life, right? Your dad's shoes, your work environment, your golf shoes that you were just on the golf course right
Right.
after
Yeah.
work. And it's just it is so true though that you you we have the responsibility then when we are going to take care of that patient, that we step in, that we are in that role. I think that's where a lot of it comes from, is because we know what are the shoes that we wear in our life. And then all of a sudden now we're in the OR and you have that self-doubt of, am I responsible enough to be doing this, and B, competent enough to be doing this? And I think that's where a lot of the emotional toll comes from. But I want to keep coming back to this idea of, you made it through school.
Right.
You graduate, you become a CRNA. You've showed that you're competent enough to do this. Don't let that self-doubt talk overcome your ability to take care of a patient. And I had a couple weeks where it did. I know I've shared this before, but I had a patient die on the table only about a month or two after I started practicing. It was somebody I came in, I believe, to relieve, and it was just a lap chole, and it happened on closing. Patient coded like 6 times, and for the next, I would say, month after that, I I was scared to death to do anesthesia. I'm not gonna lie. Like I had so much emotional um, struggle in my brain of, well, if there was a different anesthetist in the room, would they have handled that differently, and would the patient still be alive? Um, and it messed with me, for
Yeah.
several weeks. Like, am I qualified to be here?
Mm.
And that wasn't healthy for the other patients that I took care of for the next few weeks. Because now I'm sitting here in all my self-doubt, and there is a level of, when you feel competent and when you feel confidence in yourself, you're able to perform better. When you feel self-doubt, you feel the imposter syndrome, you're not going to perform as well under pressure when things arise. You're going to self-doubt uh, every decision that you make. And so there is a healthy aspect to realizing I may not know everything, right? And that's okay. But at the same time, I am qualified to be here. I'm qualified to take care of this patient, and I'm prepared to take care of this patient if X, Y, and Z does arise. And as long as you have those game plans in mind, start thinking through scenarios. If this patient were to code right now, what would I do? If this patient were to spasm right now, what would I do? As long as you're prepared and you know what actions you're going to take for those, it's okay that you don't know everything for every specific situation that's going to arise. Odds are you have another pair of hands that are going to be able to help you, another brain that's going to be able to help you. I know there are times when we were completely independent and you may not have that, but you also have resources at your disposal to help you and to be able to research and look up certain things. Like I did for that one patient for the C-section. I had to look up how to handle a certain medical diagnoses for cesarean section, something I've never seen before, but I had resources that are able to help me. So I think there's that definite level of balance, and finding that sooner than later is important. It's natural and healthy to have a little bit of fear of I don't know everything. That's normal. So if you have that, don't let that become more than it needs to be. Just know that that is a normal side that you are supposed to have. And if you felt over cocky, that is actually probably worse.
Right.
But also be confident in your knowledge and your ability. And as you go through school, as Tanner mentioned, it's hard because you have a CRNA there that you keep throwing that back off of that, oh, like they're going to fact check me. They're going to do this. They're going to do this. Start putting yourself in the mindset of, I don't have them at all. I'm making these decisions as if I don't have anybody. You need to start getting in that mode of things. And I know different programs do it different. Some leave you more alone than others. But there is that definite healthy balance to, I don't know everything, but I know enough to be here. And I have worked my tail off to get to this point. And I am capable and competent and responsible enough to be in this setting, taking care of this patient right now.
Yeah, I love it. Hopefully this is a good episode for you guys. If you are feeling this way, this is, like Cole said, not unique. We all go through this, and, be humble, be self-aware, see if that imposter syndrome is really trying to show you that, there are areas that you need to improve on or you need to grow. And more often than not, it's just our negative self-talk that is rumbling around in our head, and we're having this fear of being exposed or fear of not belonging or feeling like we don't belong. And so if you're feeling that way, again, you're not alone, but you do belong to be there. And don't let that negative self-talk help you spiral or cause you to question things that you should be very confident in. This has been a fun summer series because I think we're diving into some of the things that we get into. We're just sitting in a long case with a resident and you're just talking over these things, but these are things that I wish I would have heard a lot more about while I was going through school. And kind of piggybacking off of that, we're going to have our summer conference, not our summer conference, summer series is happening now. We're going to be having our resident conference in September 20th. We're going to be having some really great speakers come and join us. And we do this every year for residents. And the whole idea of this conference is things we wish we would have known about or known more about while we were in school. So we're going to be releasing a lot more details on that upcoming, but make sure you stick around and check that out. It's every year we just hear really, really great feedback from the attendees. And so we will be putting that all over social, put that on our website. So check that out. It's going to be really fun. We're super excited about the list of speakers that we have this year. I think you guys will have a lot to learn from them. And so make sure that you stay tuned for that. And we still have a couple more in the summer series that we're going to do, just talking about some of these more like real talk episodes. But hopefully this is a helpful episode for you to know that you're not alone, and maybe some good tools you can use to combat that imposter syndrome.